All right, lawmakers in Washington battling over how to merge the House and Senate versions of the health care reform bill. Some new reports suggest that Democrats may be favoring a national health insurance exchange program. What does that mean, and how might that affect your coverage? A fair and balanced medical debate now. Dr. Mark Siegel is a member of our Fox Medical A team, and Dr. Cathleen London is a family practice physician. All right, Dr. Siegel, let me start with you. The House version favors a national exchange. The Senate version favors a state exchange. Which is better for the consumers?
Well, actually, Greg, neither are good for the consumers, and let me explain the difference. The House bill would make insurance portable, which I like. The idea that if you had your insurance in New York, you could take it and move it to Arizona, then you could create a national exchange. That is not going to happen because the insurance companies want to game the system. They are never going to put up with it. But let's say for a moment it does happen. Then it has another problem because there's a health choices commissioner involved that oversees all of this and decides what care is good and what care isn't, what guidelines should be followed, what shouldn't. That'll end up being a form of rationing. The state plans have a problem because they're a place for the insurance companies to come together, and Massachusetts is a great example of this, Greg. 30% increase in insurance premiums in Massachusetts since those insurance exchanges started. It's like having a supermarket where instead of a grocery store, but in the supermarket, your products are still way too expensive and you don't have anybody to check you out at the checkout counter because doctors are not going to be paid enough.
You know, Dr. London, if Washington essentially subsidizes this, pays the bills, pays the money, picks the directors, and essentially runs it, isn't this just another form of the public option government-run health insurance?
Not really, because this is still, the insurance companies are still behind it. What this would set up are minimum standards. Right now, it's all state-run, so you have some states that can do things like exclude prenatal care from a premium. That will no longer be allowed. So there'll be some real unification in that you can get minimum benefits to be a part of this national exchange. And let's make it clear, the national exchange is for people who are not getting employer covered, sponsored health care. So this is so people, those of us who are self-employed or have no other means of getting health care. It will also allow people who are getting subsidized by the government to choose from different plans.
Yeah, but Dr. London, let me stick with you for a second. You seem to be advocating the national exchange, but advocates of the state exchange say, look, states would have more flexibility and consumers would benefit because it wouldn't be a one-size-fits-all coverage.
Okay, so the problem with that is the size of the pool, that when you get to, the problem we've seen in Massachusetts is that these pools are too small, so when you get to some of the higher risk patients and the higher coverage, it really does hurt consumers. When you get to a national level, you have a bigger pool, so people who are in states that are less densely populated, they're going to be hurt by a state-by-state plan.
Go ahead, Dr. Siegel.
But Greg, the problem is that the national exchanges, which again, I want the viewers out there to know this is not going to happen, because I don't want another one of these things where President Obama says behind closed doors, I want the national exchange, but it doesn't happen. It is not going to pass with the national exchange. But the biggest problem with the national exchange is we're talking about a very heavy government oversight where they come in and decide what good care and what isn't. We need decentralized medical care. I have to be able to work with my patient directly and figure out what to do. I can't be appealing to Washington all the time if they're turning down a test that I want.
All right. Dr. Siegel, Dr. London, I'm afraid we got to cut this short for some breaking news, but thank you so much for clarifying some of the very dense issues involved here. We appreciate it.
Thanks, Greg.